Mr. Yawa, so you've recently done a rapid survey to try and find out how those living with HIV have been accessing or failing to access their treatment, their medication during lockdown. Can you give us a quick summary of those findings?
Yes, ma'am. Thanks for having us. One of the findings that we picked up on the ground is that many people living with HIV were switched to the new ARV drug, which is TLD, without them being properly cancelled. And in some instances, because of the lockdown and people were fearing for the police brutality, some of the people missed their appointments. But also one of the challenges is that in a situation where in a facility, either a nurse or a patient test positive, a clinic is being closed. When a clinic is closed, a person is not referred to any other facility to be able to collect their medicines. And also during the lockdown, we have seen many people who are collecting their medicines from the CCMDB. When some of the malls were closed and some of the pharmacies are inside those malls, people were unable to access medicines. And also, one of the calls that we have made was to say people living with HIV, TB, and other chronic illnesses, during the lockdown, were supposed to be given 4 to 6 months supply in order for them not to be able to frequent facilities and expose themselves to the COVID-19. And also the other...
I'm going to jump in there, and just while we're speaking about those 4 to 6 month extended prescriptions for medication, there are some challenges involved with providing patients or HIV and TB sufferers with long-term prescriptions. What are some of those challenges?
Some of the challenges is one, is the availability of medicines, because you find out that in some areas people are still being given a 1 month supply, and in other places people are given a 2 week supply, and people are forced to go back to the facility on a weekly basis, because some instances facilities are sharing medicines, and in some instances you hear that they tell you about active pharmaceutical ingredients that are not available in order for some of the medicines not to be available. So there are a lot of challenges. But also the other things that we are missing as the country, as much as we are support the good work that has been done by our government, but we strongly believe that our response to COVID-19 must incorporate or must integrate our country's response to HIV and TB, so that we don't end up dropping the ball as the country in our response to HIV and TB.
Absolutely, and we do understand the value of people not having to access health facilities on a regular or monthly basis to try and get hold of their prescriptions or their medication. But there are also benefits for the broader healthcare system if HIV and TB patients did not have to try and go and access their medication as regularly. What are those benefits?
Can you repeat the question again, sorry?
I'm asking about the benefits for the healthcare system and healthcare facilities if patients have access to long-term prescriptions.
So one, as it has been said scientifically, that people who are immunocompromised are vulnerable to in contracting COVID. And people who are living with HIV, more especially those who are not on treatment, and people with TB and other chronic illnesses, we believe that when they continue going to facilities, they expose themselves in contracting COVID-19. So if they are given 6 months supply, it means there will be no need for someone to go and chew in those facilities. You will be at home, and the only time where you will get out of your home is only when you collect your medicines after 6 months. So
of course, there are also benefits to the healthcare facilities themselves, as they're already overburdened under COVID-19. Is that correct?
Yes, because at the end of the day, not everybody who is flocking in those clinics is in need of attending a doctor or a nurse. Others are going there to collect their medicines. So if people are given enough medicines, it means they won't be forced to go to those facilities. But also, the other challenge that we are picking up on the ground is that in our clinics, some of services that are related to HIV and TB have been dropped, like your routine viral load testing, your CD4 count test, your HIV counseling and testing, your TB screening and testing. In some facilities across the country, some of these facilities, these services are not provided because the priority is COVID-19, and that's why we think that we are going to miss or we are going to drop the ball as the country in our response to HIV and TB.
Thank you very much for your time. That was TAC General Secretary Anele Yawa.